Good day to all consultants, fellow ophthalmologists, and residents. Thank you for the opportunity given. My name is Tri Wahyu, and today I would like to present a case report entitled Ptosis Following Facial Aesthetic Botulinum Toxin Injection. Botulinum toxin, cytoplasmic toxin produced by Clostridium botulinum, has been used for therapeutic and cosmetic purposes. In aesthetical medicine, botulinum toxin type A has become popular due to effectiveness in softening wrinkles. A first reaction in botulinum toxin injection can occur as a result of injection procedure due to the biological effect of the product or idiosyncratically. Ptosis is one of the adverse reactions which can occur due to globular complex treatment. This is a case of a 58-year-old woman who came to our clinic due to a droopy right eyelid 7 days ago. She denied histories of any systemic conditions or medical treatment. Best-corrected visual acuity on each eye was 20/20 and his birth test was orthotopia, without any limitation of eye movements. Initial palpebral examination showed marginal reflex distance 1 was covered by eyelid, and palpebral fissure was 2 mm. FI was within normal limits, as we can see on Figure 1A. Aspect test was performed over the affected eye to eliminate the possible differential diagnosis, such as ocular myasthenia gravis. 2 minutes after the test, MRD1 improved to 0, and palpebral fissure improved to 5 mm. Later, in the end of consultation session, she had just confessed honestly that 5 days before symptoms appeared, she received botulinum toxin type A injections using INANOS from South Korea. Figure 2 illustrated location of botulinum toxin type A injection, where red circles represent 5 spots injections in forehead, blue represent 3 injection spots in globular complex, and green represents 3 injection spots in choroid in each side. Patient was not prescribed any specific medication, but close observation and cold compress only. Figure 1B shows improvement after 1 week. MRD1 becomes 0 mm and palpebral fissures was 5 mm. She only had cold compress for a week and later discontinued it. Over time, ptosis improved and completely resolved in the 3rd month after her first visit, as shown in Figure 1D. Ptosis is the most frequently noted complication after botulinum toxin type A injection to treat globular lines. The incidence rate varied widely from 0.8 to 3.4% to as high as 14%. It occurs when the superior levator palpebral muscle is weakened in the superior intraorbital compartment due to botulinum toxin diffusion. Development of ptosis occurs more frequently by inexperienced practitioners or patient-dependent factors. In this case, patient was already in elderly age. Some physicians recommended patients should avoid bending their heads to reduce the chance of unwanted diffusion on the toxin. However, as a Muslim, this patient still carried out salah, which composed of rakat and made her head bended. Ptosis can occur for up to 2 to 3 months. Skorokhot et al. Reported that complete or near complete resolution of ptosis in average time frame of 8 weeks. Reuters et al. Reported that moderate cases could last up to 40 days. Although ptosis after botulinum toxin type A injection is almost always temporary and self-resolving, multiple medical treatments are already available, such as oxymetazoline hydrochloride, alpha-2 adrenergic agonist, phenylephrine hydrochloride, and anticholinesterase. Our patient was not prescribed any drug mentioned previously. At first, we intended to prescribe a proclonidine or brimonidine eye drops, but these drugs are difficult to find in Indonesia currently. This patient ever had cold compress for a week, and she felt her ptosis improve. It suggests that cold decreases the acetylcholinesterase activity at the neuromuscular junction, resulting in increased acetylcholine and stimulation of muscular muscle contraction. In conclusion, the risk of botulinum toxin type A induced ptosis can occur in elderly patients, especially if they have a reduced or absent orbital septum. Over time, botulinum toxin type A induced ptosis in this case resolved spontaneously without any medication. Thank you for your attention.